How tobacco affects our body. 1. Cardiovascular effects. Smoking causes damage to the lining of the blood vessels, making them more susceptible to the buildup of plaque. This can lead to the narrowing of the vessels, which can decrease the blood flow to the heart and other parts of the body. This can increase the risk of heart attack, stroke, and peripheral artery disease (PAD). Additionally, smoking can cause the formation of blood clots, which can lead to heart attack, stroke, or other serious health problems. 2. Respiratory effects. Smoking damages the lungs and airways, making it harder to breathe. This can lead to chronic bronchitis, emphysema, and lung cancer, which is the leading cause of cancer death worldwide. Additionally, smoking can increase the risk of respiratory infections, such as pneumonia and bronchitis. Smoking can also cause wheezing, coughing, and shortness of breath. Secondhand smoke can cause respiratory problems, such as asthma and lung infections. 3. Cancer risks. Smoking is a major risk factor for many types of cancer, including lung, throat, bladder, and oral cancer. Additionally, secondhand smoke can also increase the risk of cancer. It is estimated that about 30% of all cancer deaths are caused by tobacco use. 4. Effects on reproductive and developmental health. Smoking can affect both men's and women's reproductive health. Men who smoke may have a lower sperm count, and women who smoke may have a harder time getting pregnant. Additionally, smoking during pregnancy can increase the risk of miscarriage, premature birth, and low birth weight. Smoking can cause several changes to sexual health, including problems with sexual function and fertility. The chemicals in tobacco smoke can damage the blood vessels, which can lead to decreased blood flow to the sexual organs. This can cause erectile dysfunction in men and difficulty becoming aroused or achieving orgasm in women. Additionally, smoking can decrease sperm count and quality in men and can make it more difficult for women to become pregnant. Smoking can also affect hormone levels, which can lead to changes in sexual desire and function. Nicotine, the addictive substance in tobacco, can affect the release of hormones such as testosterone and estrogen, which play an important role in sexual health. Smoking can also affect the health of the cervix and uterus, which can increase the risk of cervical cancer and other problems related to pregnancy. 5. Effects on oral health. Tobacco can have a significant negative impact on oral health. The daily use of tobacco can cause damage to the teeth, gums, and other structures in the mouth. This can lead to an increased risk of tooth decay, gum disease, and other oral health problems. Tobacco can cause bad breath, yellow teeth, and stained teeth. It can also cause dry mouth, which can lead to tooth decay and other oral health issues. Tobacco can also increase the risk of developing oral cancer, which can be deadly if not caught early. Additionally, exposure to secondhand smoke can also have negative effects on oral health, making it important for smokers to take steps to protect their loved ones from the negative impacts of their habit. 6. Effects on the immune system. Smoking cigarettes can have a significant negative impact on the immune system. The chemicals in cigarette smoke can damage the cells and tissues that make up the immune system, making it less effective at fighting off infections, illnesses, and diseases. This can lead to an increased risk of developing various infections, such as respiratory infections, as well as a slower recovery time from illnesses. Smokers also have a higher risk of developing certain types of cancer, such as lung cancer, as well as chronic conditions such as pneumonia and tuberculosis, due to the weakened immune system. Secondhand smoke also has similar effects on the immune system. 7. Effects on the skin. Smoking can cause several changes to the skin, including wrinkles and premature aging. The chemicals in tobacco smoke can damage the collagen and elastin in the skin, which are proteins that help to keep the skin firm and elastic. This damage can lead to wrinkles, sagging skin, and age spots. Additionally, smoking can decrease blood flow and oxygen to the skin, which can make the skin appear pale and dull. 8. Effects on the bones. Smoking can cause several changes to the bones, including an increased risk of osteoporosis. Osteoporosis is a condition that makes the bones weak and more likely to break. The chemicals in tobacco smoke can interfere with the body's ability to absorb calcium, which is essential for strong bones. Additionally, smoking can decrease blood flow to the bones, which can further weaken them. Studies have shown that smokers have a higher risk of osteoporotic fractures than non-smokers, particularly in the hip, spine, and wrist. Women who smoke have a greater risk of osteoporosis and fractures than men, due to the effect of smoking on estrogen levels. Smoking can also affect the healing process of bones. Smokers who break a bone may have a harder time healing and may be at a higher risk of complications such as infection and non-union failure of a broken bone to heal. 9. Effects on the muscles. Smoking can cause several changes to the muscles, including muscle weakness. The chemicals in tobacco smoke can interfere with the body's ability to produce and use certain hormones and enzymes that are important for muscle function. Additionally, smoking can decrease blood flow to the muscles, which can further weaken them. This can make it more difficult to perform everyday tasks and make you feel more fatigued. Smoking can also affect muscle recovery after exercise or injury. Smokers may take longer to recover from muscle injuries and may experience more muscle pain and soreness. This is likely due to the decrease in blood flow and oxygen to the muscles caused by smoking. Smoking can also affect muscle endurance and stamina. Studies have shown that smokers tend to tire more easily and have a harder time completing physical tasks than non-smokers. 10. Effects on the urinary system. Smoking can cause several changes to the urinary system, including an increased risk of bladder cancer. The chemicals in tobacco smoke can damage the cells in the bladder, which can lead to the development of cancer. Additionally, smoking can irritate the bladder and increase the risk of bladder infections. Smoking can also affect the kidneys. The chemicals in tobacco smoke can damage the blood vessels in the kidneys, which can lead to kidney disease. Additionally, smoking can increase the risk of kidney cancer. Smoking can also affect the prostate in men. The chemicals in tobacco smoke can cause inflammation of the prostate, which can lead to symptoms such as difficulty urinating and an increased risk of prostate cancer. 11. Effects on the digestive system. Smoking can increase the risk of pancreatic cancer and cause ulcers and other stomach problems. 12. Effects on the brain. Smoking can cause several changes to the brain, including an increased risk of stroke. The chemicals in tobacco smoke can damage the blood vessels in the brain, which can lead to a decrease in blood flow. This can increase the risk of stroke, which can lead to damage or death of brain cells. Additionally, smoking can increase the risk of dementia and cognitive decline. Smoking can also affect mental health. Studies have shown that smokers are more likely to suffer from depression, anxiety, and other mental health disorders. Nicotine, the addictive substance in tobacco, can cause changes in the brain that can lead to addiction and withdrawal symptoms. Smoking can also affect the developing brain in adolescents and young adults. Nicotine can alter brain development, which may increase the risk of addiction and other mental health problems later in life. 13. Effects on the nerves. Smoking can cause several changes to the nerves, including damage to the nerves in the arms and legs, leading to tingling, weakness, or loss of sensation. The chemicals in tobacco smoke can damage the nerve fibers, which can lead to a decrease in the function of the nerves. This can affect the ability to feel touch, temperature, and pain, and can cause muscle weakness and difficulties with coordination and balance. Additionally, smoking can increase the risk of developing peripheral neuropathy, a condition that damages the nerves in the hands and feet, leading to tingling, numbness, and pain. Smoking can also affect the nerve cells in the brain and spinal cord, leading to problems with memory, mood, and cognitive function. Nicotine, the addictive substance in tobacco, can cause changes in the brain that can lead to addiction and withdrawal symptoms. 14. Effects on the eyes. Smoking can increase the risk of cataracts, a clouding of the lens in the eye that can cause vision loss. It can also cause damage to the retina, the part of the eye that sends visual signals to the brain.